Hello everyone. Today we are going to talk about the thermal regulation in neonates. This is the part of grand round presentation for neonatology fellow at our institution. So I will skim through some slides, and if you have any comments, please reach out to me. I have no disclosure. The objectives are listed here. So basically, three components of neonate that we have to be aware about. One is water birth, the bathing that is done in the nursery, and delivery room to NICU care. These are the three areas where a neonate could have a potential of becoming hypothermic. So why water birth? As you guys can notice here, that in water birth the temperature lower range could be 33. So imagine if the baby is delivered in this temperature, the baby could be at risk of hypothermia. What about bathing in the nursery after birth? As you guys can see that WHO recommend at least waiting for 24 hours before the baby needs a bath. You can just gently use the wet towel as listed in this portion. And then lastly, the delivery room to NICU. Unfortunately, despite of all the effort which we take, the delivery room hypothermia still exists, and I'm going to touch more when we go further. So thermal, as the name states, anything to do with the heat, and heat is basically a byproduct of heat produce and heat loss, and body has to have a balance of it. So here we all know that we are homeothermic, so we adjust our temperature as compared to other organism. Those are poikilothermic. So thermogenesis, basically how heat is produced in response to cold, either by voluntary muscle activity or involuntary muscle activity. So what happens in neonate, as we know that they don't have much voluntary muscle movement, also they cannot shiver, so these two elements of producing heat is not there. Now what about non-shivering thermogenesis? And for that purpose the neonate has brown fat, and brown fat can generate heat by chemical thermogenesis, and this is the area where brown fat is, and these are the reasons why brown fat can produce heat chemically, because they are rich in mitochondria, they increase in fat vacuoles, and as you guys remember that fat produces 9 kilocalories by burning 1 gram, and it has dense capillary network. The other factor why newborn heat loss, they lose more heat than adults or kids. Two reasons: basically they have large surface area, and second, their skin is permeable. And you guys can see here a preterm infant, if you guys can see, look at the layers as compared to the term infant. So they have a lot of tendency for transepidermal water loss. And also if you see the circle, compare the surface area of a newborn with an adult. So that's why they are prone to heat loss. So now let's move to the next slide. So this is an important slide, and I want you to pause the slide and take a look and try to match which one is showing heat losses and the mechanism. Okay, I hope you have looked it up. So let's walk through. So here, this is the conduction. As you guys can see, there is a fat, the mattress is there, heat mattress, and that is preventing the conductive losses. Then comes your convection losses. The baby is wrapped in saline wrap, so basically the airflow which is coming here is not going to take the baby's heat away, so that is preventing the convection losses. What about this one? This is, as you guys can see, there's a baby there, very small premature baby, and this incubator is humidified, preventing the evaporative losses of the baby. And the last one is an example of radiation losses. With the use of double wall incubator, this is less and less now, but you just have to be aware that if you put a single wall incubator near the window, so what happened, the incubator loses the heat to the window, and then the baby ultimately loses the heat to the incubator. So that's why there are radiative losses. So just look at this picture and memorize these 4 losses, which we are going to talk about again. This is an important slide, especially for those who are taking neonatology board, that see with the gestational age how the evaporative exchange decreases. So by the time one reaches 33-34 week, the evaporative losses are minimized, and this graph display the same thing. And again, this is because of the skin immaturity. And this is another slide that shows the radiative losses increases the gestation, and evaporative losses decreases the gestation. This is an important concept which is called as a neutral thermal zone. This is the zone or the range of the temperature where oxygen consumption and heat production is minimal. So just remember that we have a normal temperature, and within the normal temperature we have a zone, and that zone is where we don't have much of the metabolic processes going on, so which is elicited by this yellow box. And again, remember that normal neonatal temperature from the skin is 36 to 36.5 and 36 to 37 if it's taken rectally. And this is another concept, easy way to remember. Just follow, like, this is a 1 kilo baby, this is a 2 kilo baby, and this is a 3 kilo baby. The only thing, if you want to remember from this slide, the more weight wise and the age wise, the postnatal age and the weight, you see how the operative thermal environment changes. So like here it's 36 and now it just comes down. So it's common sense, which will show in the next slide. So here you see, like, postnatal age, the increase in postnatal age, your temperature requirement decreases. As you guys can see, it's 33 now, and same goes with the gestational age. So in conclusion, if you want to remember, the idea is that prematurity, weight, and postnatal age, these are the three determinants that decide about the set temperature of a neonate for neutral thermal temperature. And this is highlighted now. Another slide, this is taken from the textbook, the idea of skin to skin care. And the important concept here, the many centers do follow skin to skin. Just remember that, as compared to incubator care, when somebody starts skin to skin, the temperature falls to 35.6 or 7, but gradually the temperature matches the incubator temperature. So skin to skin temperature, if somebody asks you, is a risk for hypothermia, the answer is no, maybe initially, but then the baby catch up within the 60 minutes of skin to skin care. This is a table taken from internet. Just remember the same thing, the younger and the smaller is the infant, the more temperature you need. So now design thinking. So there was time, when these fancy incubator like these ones are not available. So we used to use warmer. Now we have Panda. Panda is used in delivery room, and Panda does not have the full covered incubator like this. So basically, this could be used in delivery room, and some centers do have. They use giraffe in delivery room. They have designated giraffe, so the baby is delivered, baby is managed, lines are done, this is closed, and this incubator goes to the nursery. So that way they avoid shifting into the transport incubators and other stuff. So this could be done, and this is what design thinking is, that engineer thought, why not create one-stop shop, and this is a good example. I'm not advocating any brand over other. So what are the practical aspects? So, this is another table. Basically, the nurses follow this as a protocol. They know where to start, when to check the temperature. They will be working on this side of the screen. The point which students and neonatologists has to know, that there are 3 temperatures you have to look for. Again, remember, if the air temperature is almost matching baby's temperature, it means that baby is not ready to come out of the incubator. Baby still needs to be in the incubator. So this has to go down, and this has to remain normal so that we can start weaning. So this is an example here, and as shown in the display, you guys can see that how, once this temperature is coming up, it was 36.2, now to 36.5, and see how the set temperature has decreased from 29 to 25. So this is what we call servo mode. So basically, this is just like the thermostat in your home. Once the temperature goes up, the AC kicks in, and when the temperature is maintained, whatever you have set at, the AC is off. And again, the concept of neutral thermal environment is there. Okay, so like we said, despite of doing all the things which we know, as you guys can see in this slide, that the hypothermia still is like 6.3% of the babies from this is a 7-year data, and you guys can see that we still have hypothermia there. So this is not really a problem which is resolved. And this is from LCOR, and they talk about that how it is very important to maintain temperature, especially in preterm infants. This is a very nice article, and I think we all should have this as a reference in our unit. And so this basically talks about different factors which are important in preventing these areas and covering. For example, we should have a room where the temperature is maintained. We in our center have a separate room for newborn babies, so we are not in the OR. But many centers, the neonatologists are in the OR where the baby is delivered in the same room where the temperature is low. So just make sure that you take care of that. Second thing, we have a preheated warmer that should be on. Then, of course, other factors like providing a hat on the baby, covering the baby with saline wrap to prevent heat loss. Of course, the conductive losses has to be prevented by use of blankets, thermal blanket, and always use humidified, oxygen if needed. This is another article. It talks about how to again prevent. There are other measures. You can pause the slide and read it at your pace. The other idea is, which is important, that there are many quality improvement exercises you guys can do. You have to find what is missing in the link. Suppose your NICU admission temperatures are relatively lower, then you have to find what is happening between delivery room and the transfer. Maybe you don't have a transfer incubator, or maybe you need a single stop type of an incubator where everything is done in one and then you transport the baby. Just throwing an idea. And this is a question. You guys can log into my YouTube page and read this question, and please do comment. And this is the final slide. If you have any comment or caution, please reach out to me. Thank you so much, and I hope you enjoyed this presentation. You guys have a wonderful day. Bye.